Thank you all for being here this morning. We are going to have the Republican leader of the House Administration Committee, Mr. Davis, speak to us in just a minute about some of the procedures and operations changes that are going on here in Congress. We just came from a very useful and important Republican conference meeting. We heard from a number of people, including Dr. Scott Gottlieb, talking about what to be prepared for, what to expect. We all take very seriously the situation with the virus. I think it's very clear, as you've heard from Dr. Fauci and others, we're into a period now we really need to be responsible about mitigation. We need to be responsible about social distancing. Particularly, there's new guidance the CDC just issued within the last 24, 48 hours about if you're over 60, you're at an increased risk, and thinking through what that means. Every member of the House obviously is looking at ensuring that our offices are prepared if our members if our staff members work from home, making sure that they're able to do that, and also just taking very basic responsible steps to avoid large gatherings that are non-essential, to make sure everyone's following all of the important hygiene recommendations that we've seen. We take seriously Congress's constitutional obligations and constitutional duties to continue to operate, to continue to function. And we also know that we have a responsibility with respect to issues like people who are coming here for visits, tours here, making sure that we're putting health and safety of our members as well as our staff and as well as the tourists who come here to visit the Capitol, putting that first. So there are a number of discussions going on in that regard. But we all are working closely to ensure that across the board and across the country, people have the resources they need to be able to address this health challenge and to ensure that we are being responsible and taking necessary steps to keep people safe and healthy and to limit the spread. I think that's really the key right now, is to ensure that we are slowing transmission, limiting the spread, making sure we're being responsible about that. So with that, I would like to turn things over to the gentleman from Illinois, Mr. Davis, Republican leader of the House Administration Committee.
Thank you, Madam Chair. First off, I want to commend the House officers and the committee members on our House Administration Committee on both sides of the aisle, along with the leadership teams of both the majority and the minority. They've been working hard on a coronavirus task force that includes the representatives from each of those areas and agencies I mentioned. They're in constant contact to ensure that they're giving the most up-to-date guidance to not just staff, but to the entire House campus and each and every one of you. Our conference, our House Administration Committee, along with the assistance of leadership and the others that I mentioned, had a briefing with our chiefs of staff yesterday. So did the Democrats. Those are necessary to be able to spread the most up-to-date guidance. Our committee, the House Administration Committee, in a bipartisan way, also decided to do what we could do to make sure that member offices are prepared. We've allowed now the use of unspent 2019 funds in the MRAs to be used to purchase equipment that could go for a continuity of operations plan and allow staffers to telework if necessary. But we also have set up what we call a genius bar in the Rayburn cafeteria to allow the CAO and the Office of Technology to be able to assess any equipment that you may have in your offices or may purchase through the CAO and through the office supply store to be ready just in case your office has to anyone in your office has to telecommute. Now, you've probably seen around the campus, there have been extra efforts to sanitize the Capitol complex, sanitize our House office buildings. The architect of the Capitol, Brett Blanton, who's brand new, is doing a great job getting his team to clean the elevators, handrails, doorknobs. They're now being wiped down at least twice a day, whereas that wasn't the case before. Bathrooms are being cleaned twice as often as usual, and the Capitol Police and architect of the Capitol, Blanton, are working together to ensure all security screening equipment is cleaned and sanitized. You'll notice new bowls at the security screening stations. You're going to also notice we're going to see more hand sanitizing stations, and I'm going to give you the same advice I just gave to my fellow members of Congress. You're going to see more signs in the bathroom about how to properly wash your hands. If you see those signs and you reach down and there's no soap, please don't tweet about it. Please don't decide to use that as a social media moment. Call House admin, call the architect of the Capitol, and we'll get soap in that dispenser as quickly as possible. We are advising offices on House administration. We are advising in a bipartisan way that every single office needs to have a continuity of operations plan. That's why the equipment purchases are necessary right now. Be ready, be prepared. We don't want anybody to shut down their ability to serve their constituents in their offices, be it here in D.C. or be it in the district. Plan now, have that plan in place. We want to make sure that everyone understands that we're cleaning the Capitol, but they also need to take proper hygiene measures themselves. We're working with the guidance of Dr. Monahan, the attending physician. Good hygiene practices, wash your hands, try not to touch your face, things like that we're reminding staff to do. And we want to make sure, again, we have the ability to communicate with our constituents. We've issued guidance to ensure that members know, even during a blackout period, that they can communicate about the coronavirus to their constituents. We're working with each individual office to get messages out, but our advice to each and every member is talk to those health professionals in your district too, and understand that the federal government, state government, and local officials all need to be working together. And when you listen to them, we hear that the United States of America is doing everything we can to ensure that we have a great response to this outbreak, and one that's going to get us to the point where this outbreak will be in the past. So with that, thank you for having me.
Thank you, Rodney. I appreciate your leadership and what both Republicans and Democrats are doing to make sure that the Capitol is as safe as possible anytime, but especially now when you see what's happening with the coronavirus and how you're starting to see more cases. We've just seen a case in Louisiana as we're seeing more states recognize that as testing increases, the prevalence of the number of people who test positive will increase. But we also need to be aware of just how to take basic precautions. Just like in an active flu season, you want to make sure that you're taking proper hygiene steps. And I think everybody's hearing the same message now. When you come in contact with people, make sure you're washing your hands on a regular basis and doing it properly, reducing or eliminating handshaking and taking other measures so that you're reducing the risk of coming into contact with any kind of virus, but especially the coronavirus, as we work with the drug companies and others to come up with a vaccine, as the testing for various possible vaccines is underway. We're going to continue to do everything we can to make sure that CDC, the FDA, and other health agencies are working as closely as possible. And I know Vice President Pence has taken the lead and has been going to a number of these locations to make sure that they've got the tools they need, and Congress has come together to do that. We need to continue to make sure that we are addressing the policy side as needs occur. I know there is one piece of legislation that's scheduled for the floor this week that I would urge Speaker Pelosi to pull back on, and that is the No Ban Act. You saw at the very beginning of this, President Trump was able to take quick action when so many cases were coming out of China. And we still don't know enough about the genesis of this disease in China and how it may have started there. Unfortunately, they didn't share enough information with us as quickly, where we could have done more things earlier. But at the same time, the president was able to take quick action to limit the number of people coming in from China that had exposure to coronavirus. The No Ban Act would make it more difficult for the president to keep Americans safe by addressing needs as we see other countries like Iran. You're seeing a potential large outbreak in Iran. Iran's one of those countries that we currently have a travel ban on because they don't allow us to properly vet that terrorists aren't coming into our country. And so while the No Ban Act may be focused on that, which in and of itself would be bad policy, the president ought to be able to keep potential terrorists from coming into our country. But now with this outbreak of coronavirus, the president also needs to have all the tools available to limit people coming in from countries with a high propensity of coronavirus. And you wouldn't want legislation that would make it more difficult. Hopefully that bill gets pulled this week. But in the meantime, we need to continue to do all that we can to ensure that the administration has the tools they need, and we're working together to inform the public of the various precautions that they can take as we're trying to find a vaccine and make sure we limit the growth of this virus. With that, turn it over to the leader of our conference, Kevin McCarthy.
Thank you, Steve. I want to take one moment to communicate directly to the American public. I want to ensure that every person in this country knows that our government is taking every precaution available to keep you safe. It is our priority as we continue to mitigate and contain the spreading of this virus. We will continue to learn more about the coronavirus every single day. But I do want to talk about what we have done as of today. Last week, we passed a coronavirus funding package that will help speed the development of a vaccine, increase the access to testing and treatment. And one element I do want to highlight, telemedicine. It allows you to stay home, communicate with a doctor in today's age so you're not flooding the medical capacity, but at the same time spreading the disease as well. We are dramatically increasing the number of tests available. Private companies have started to ship tests last week. This will continue to grow. We're exploring all possible options also to bridge the gap for working Americans who are being impacted by the coronavirus. Steve talked about this just earlier. If it's one thing that the speaker should look at is not to move forward on the No Ban Act. This will harm the ability for this country to continue to keep us safe. It is the wrong time, wrong place, and wrong legislation even to be talking about. I also want to take this opportunity again to underscore the simple actions individuals can take. I want to thank Rodney Davis for his work and House administration working together on a bipartisan basis. But from the same point, the 4 leaders met last week. We met with the medical professionals, with the architect of the Capitol as well, and we will assess it day to day on measures that we could take to continue to keep this process safe as we move forward. There's also a website Americans can access to learn the most up-to-date information on the coronavirus. I can encourage all those seeking information to go to coronavirus.gov. In the end, we remember that the most smartest and capable health experts are in this country. John Hopkins actually, in a recent study, said it's one of the best health providers in the world is right here in America. I think the ingenuity of America again will show that we can lead the world. It's unfortunate at the time when we made the offer early on at the beginning of this year to send our experts, our doctors, our researchers, and our scientists into China that Xi did not allow them in. If we were able to contain it just within China, the rest of the world would be safe. Unfortunately, today, that is not the case. So we're combating something different. But we spent the resources for treatment, to be able to have a vaccine, and also to have telemedicine so individuals to stop the spread of where we are today, and we'll assess it as we go on. Let's open it up for questions and comments. Yes.
We've got a number of members that are self-quarantining. Congressman Gomer had exposure to somebody who was infected at CPAC, but decided to come to the Capitol, to come to votes. Is there more that GOP leadership needs to do to protect its members? And is it worth being in session this week to do this business, or should you go out and take a longer recess until everybody's healthy and you can ensure that everyone's protected?
Continue to work with all 4 leaders to ask that question about whether to be in, and we consult with the medical experts. As you know, we have physicians here in the Capitol. When it came forward that individuals could have come into contact with somebody at the convention there, they made sure that they consulted with the physician here in the Capitol. None of them are showing any symptoms. It's been a number of days, more than 10 days since that took place, so all of them are taking the recommendations from the medical doctors on what to do. Yes.
Your reaction to the negative ads about the coronavirus and the response from Republicans?
That the Democrat Congressional Committee put up just last week, it was horrific. The idea that they would take an opportunity when they did not move the supplemental that week to hold it up to run political ads. This is not a time for politics. This is about the safety of the American public. I think Sherry Boutros owes America an apology. Why would she spend campaign money? Why would she do this when her party controls Congress and they did not pass something that week and they sent us home? Yes.
The president yesterday floated the idea of a payroll tax cut potentially. I'm just wondering what else you might be hearing in terms of economic measures to provide relief to people who may not be working, and your reaction to that idea specifically about a payroll tax cut.
Well, we're looking at a number of measures. Remember, we have a very strong economy, very low unemployment, but we want to look at, is there a surgical way that those who are hurt, hourly wages and others, is there an ability to help to keep the economy moving as strong as it is today? I talked to Treasury Mnuchin. We've got Kudlow coming in as well. it's a number of measurements that we're looking at, but we want to be best served. And so you'll hear us as we move forward. Kevin Brady and I have been discussing a number of measures. Yes.
President Trump has focused on the fact that coronavirus is not as bad as flu, despite the high death rates. Do you think that that is an accurate and appropriate message, given that the virus isn't contained yet?
Well, the one thing we see, I've watched from this president, the president realizes that this is a very contagious disease. That's why the president took the action to stop the flights from China to America, when a lot of people on the other side of the aisle criticized him for doing it, but that was a very smart move. The president then offered to send our scientists, our doctors, into China to help China combat this. Again, China declined the ability for this president to take those actions. The president has put the CDC, NIH in meetings from the very beginning, and the military as early back as January. You've watched the president's administration come to this Capitol as early in January to prep and brief the entire Congress and Senate about the coronavirus and what was coming. He's taken this very serious from day one. Unfortunately, you didn't hear about or read about it because at that moment in time, the majority party was spending their time impeaching the president. But no, I disagree with the basis of your question. He knows this is contagious. He knows, because he's taken the actions, he knows what he's been doing with the administration and others, of how serious this was, and he was warning us prior to anybody that was paying attention.
But not as serious as the flu.
No, it is more serious than the flu. Not as, from a SARS, is not as, the mortality rate is not as high, but it's much more contagious. Otherwise, the president would not have taken the action of declining flights coming into America as early as he did when others would criticize him for it. So yes, the president realizes the seriousness of this and has taken it in the nature of what we realized, and he was correct.
Can
Yes.
you just give us a quick update on FISA, where the negotiations stand, and whether we could see a vote before the March 15th?
We had good negotiations over the weekends with the Democrats and Republicans. I had a microcosm of our conference in today, bringing the Attorney General in as well, because we want to make sure that whatever we do, especially when it comes to reforms, that it works, that we're able to provide the usage of why we need FISA from the same time of the protections for every American. I think we're in a very good place. This morning, we brought back to the Democrats some other changes we would have to where we are in negotiations. Hopefully, we could get that done today and vote before the end of the week.
Mr. McCarthy?
Yes.
Hello.
Hello, how are you?
Good, thank you. On paid family leave specifically, is that something that you all support? Could you see Congress doing that, or is there a way for the president to do that administratively? Do you know whether they're considering that?
I think whatever we do, whenever package we look, it would have to be legislatively. There's a lot of different options on the table we're talking about. Remember again where unemployment is. Remember again, just a couple weeks, less than a week ago, the jobs number of more than 270,000 when most people thought it was 100,000. I know what the market did yesterday, and the combination of coronavirus and the Saudi Arabia and Russia fighting over the price of oil. I want us to be smart about what we do and help those who need the help. And so we will look at all different options. We'll take it through committee, and we'll be prepared to take action in coming days. Thank you very much.
Thank you.